It's been an amazing show on this Tuesday edition of Wake Up Nigeria, and it's my pleasure to still sit here with you. But right now, we have a very interesting conversation. As our final conversation, I have with me Dr. Olawale Ogunlana, a medical doctor and founder of Healthcraft Africa. Now, he breaks down complex medical conditions into clear, engaging videos, now turning digital platforms into powerful tools for better health across the continent. Welcome to Wake Up Nigeria.
Thank you.
It's a pleasure having you here, Doctor.
Thank you so much for having me.
So now, first of all, my brother is a lawyer. Sorry, my brother is a doctor. And there's when it comes to certain things, I'm like this person. So let me ask you, why did you decide to be a doctor? And what would you say, or which of the negatives of being a doctor do you say you identify in your life? Honestly, be honest. Okay,
so I'll start with the second question. The negatives, ideally, I think one of the negatives, or I wouldn't really say negative, is because medicine tends to take a lot of your time. So if you really give into it, it's going to take a lot of your time. Okay. But thankfully, the work that I currently do helps me to get some time out to do other things and pursue other passions. And in fact, that's one of the building blocks of Healthcraft, because we realized that a lot of doctors had not so much time to, create literacy content. Yes. So we decided to really double down on that and help, help other doctors to come out and then, create health content for Africans in the, across. Okay, amazing. So I was tilting towards the angle of God factor, but okay. So that part, I don't, it's not arrogance, it is confidence. And a doctor also, one of the things about medicine is that you have to be sure. You can't guess. Yes, not just guess. You can't be worried. You can't be anxious like the patient. You can't be panicking. So medicine requires you to, stillness. Sometimes you need to be firm. Sometimes you need to say, I'm going to do this. Even if you're not sure, you can't even display that you are not sure. Yes. So sometimes people think of it as arrogance, but then sometimes it has to be done because sometimes you just have to go, you have to be like that. Yeah, be like that. For the sake of
other people. I mean, and to be honest, it's totally understandable, considering the fact, the time you guys put in to actually study this profession, and then the work you have to go through and the exams you have to pass. Yes. Now tell me, I totally understand, and kudos to all you doctors out there, well done. Okay, but now, I like the fact that we're having this conversation because, this is 2026, we know that now we're in the digital era. And now you have used the platform TikTok to let you do great medical work. Yes. Once upon a time, we see doctors as stiff, as serious, as not flexible, but now we literally see doctors in this spaces trying to make us understand medical terms, right? And I think that's brilliant. So let's talk about, TikTok celebrating you as one of the top 50 content creators to look out for. Congratulations on that, by the way. So how did that make you feel? And then what has been the implication of that so far?
Well, the feeling has been incredible, but at the same time, it has really been humbling. When I started the journey, it was pretty simple to ensure that I realized that when I was speaking to patients, maybe 30 patients in the clinic, it was just 30 patients. But then I started asking myself, is it possible for me to speak to many people at once? Sure. So, and that was the reason why I decided to start making content for media. And TikTok as an, entertainment platform was just the perfect one. I realized, actually, in fact, true story, my first viral video went on TikTok. It actually happened. And the funny thing is that I think it was on malt and milk, that it doesn't give you blood.
It does not.
No, actually, it doesn't. It doesn't. You didn't watch the video. It doesn't. It literally doesn't. In fact, if you're going to be taking malt and milk, just say that you want sugar. Yeah, it doesn't. It contains near zero iron. Really? The real thing that you're looking for is ugu. So if you say even if you say, okay, you want to blend ugu with malt, for instance now, right? It is the ugu content that gives you iron, that helps with the building of blood. So what does the milk do? The milk is just for taste.
Just enjoyment.
Yeah, just enjoyment. It's just enjoyment. So when I made that video, that was one of the first videos that went viral. And then there was a video, tackling drug abuse that also went viral. And basically, TikTok as an all-round, entertainment platform really made it easy for me to pass the message of health. And it was so easy creating content you know, creating content and, you know, in the context of African nuances that people could relate to. And that was the thing that really inspired me to keep making more content. And honestly, it's been a very wild run. I never knew. I was just, as at the time when I was doing it, I didn't know that things like this existed. I didn't know that, you know, the algorithm and even TikTok globally was watching and seeing that these videos were having real impact in people's lives and, you know, helping their decision making and all of that. So I really say that it's been a great journey so far, and honestly, this has been unexpected. But at the same time, you know, we are humbled and we want to do more.
Amazing. Definitely great. I mean, as you did say, from 30 people now, you're meeting millions of people, explaining this local, nuances we've had from growing up, because I knew malt and milk from the longest time, since I can remember. Do you understand? But now let's talk about the importance of taking this complex medical terms and breaking it down. Because once upon a time, it seemed as if, okay, fine, doctors tried to, I don't know whether they tried, but it just came across as if, their terms were their terms for them. So they'll tell you what you need to know. You don't need to understand the rest part of it. Do you understand? It also, some people also say, okay, that also could be seen in their writing. Because doctors write prescription, you cannot read it. And we are wondering what's going on.
The prescription is for the pharmacist.
It's for the pharmacist, it's not for you. Exactly my point. So why do you think now, more than ever, it's important to break down these complexities into simple terms everyone can understand?
So, like you said, medical jargon is very complex, right? And it is when patients don't understand, when patients, when you communicate medical jargon to patients, they become confused. That's the first thing that happens. And that confusion can create panic and fear. So a patient comes to you because they want clarity on what is wrong with them. And then you speak to them in high-functioning medical jargon and tell them that, oh, you are dealing with anemia. Please, for God's sake, what is anemia, right? So it is important that in today's day and age, we are able to, so to continue my thought, right, that fear now creates a sense of mistrust because you are not communicating to them. They are and you know, so they go seeking more answers. They end up searching, you know, Google, they check other platforms, and then they become more at risk of misinformation and, you know, things that will explain it to them in the way that they will understand. And most times it ends up being misinformation. So these were the gaps that we were seeing. So I, as a medical doctor, decided that, okay, let's start addressing these gaps. Let's start explaining these things to people so that when they come, they understand. So when I say that, you're having anemia, but what that means is that your blood level is low. They will now begin to understand, oh, you mean, okay, the level of my blood, how does it affect me? So these things, and when you look at it in Nigeria, we have about currently I think the doctor to patient ratio is about 1 to 6,000. So doctors don't really even have time to say they want to sit down and explain everything to you in about 30 minutes consultation, right?
Because there's a queue and they have to
So what we are trying to do is that we are leveraging, you know, entertainment platforms like TikTok to bridge that gap so that even if your doctor doesn't explain it well to you, there is a doctor that will be able to give you vetted information that will be within your own context of understanding. So whether it is Pidgin English, broken English, or just English itself, or Yoruba, or anything, we can have more of this content, you know, health conversations online that are vetted and are being led by medical professionals. And I think that authenticity is what is the most important part.
I think it's very brilliant what you're actually talking about. And of course, because everyone is online now, as opposed to the number of people that actually go to the hospitals for probably monthly, yearly checks, right? So you definitely know you have what you're looking for right there on the platform. So, but now again, you spoke about vetted professionals, which is very important. Yesterday, I was actually filling out a survey and someone was asking me, would I do a WhatsApp medical consultation? And I'm like thinking about it, like, okay, how would I be able to ascertain that a doctor, because anybody can pick up a phone and do a video and talk about, and we've seen it, right? We have everyone, there's overload of information. So now how do you guys, using this platform, verify that these doctors, right, are licensed and they are saying what they are meant to say?
Amazing. That's a very good question. So and this is part of the work that we do at Healthcraft too, because we work behind the scenes to work with doctors who are currently practicing actively in the profession and are also at the top of the career, that is, they are specialists in this space. So that's one of the things that has really helped us. One thing we have realized so far is that a couple of years ago, healthcare used to start in the clinic.
Sure.
But right now, what we are seeing now is that preventative healthcare is starting in your phone screen.
True.
So people are beginning to get care there. So what we are trying to do now is we want to bring healthcare to the screens of people, especially preventative healthcare and preventative health advice that would help to change behaviors and that will help people improve their health-seeking behaviors at times. So what we are doing at the moment with regards to your question is we are making sure that the doctors that we work with are currently practicing, they have an active license, and they are also in the top 1% of the specialists. When we say that, okay, if you are going to be getting advice in pregnancy, it will be from a gynecologist or in collaboration with a gynecologist. If you are looking for advice with your heart, you'll be getting it from a cardiologist. If you're looking for something for your skin, you should be speaking to a dermatologist. So we are trying to bring all of these kind of specialists online. That's the work that we are currently doing with Healthcraft Africa. And we've been doing that. We have about close to over half a dozen specialties already that we are doing that for. And that's part of the reason why we are having more of this vetted information and vetted specialists out there, speaking the health language.
Amazing. You're doing great work, and I'm going to say thank you and well done. Sadly, it's a live show and we're crunched on time. We have breakfast ready, so we need to take you to the kitchen so you actually taste what our chef has prepared.
All right, that's
now.
amazing.
It's been an amazing show, and we're finding out the kitchen.
Wow.
Rumor.
Wow.
This is the first time in the kitchen that I want to track that.
You want to
Okay. How do I
tell us what
taste,
is tasting now.
Okay, so what am I tasting first of all?
It's a secret.
I'm tasting creamy pasta.
Okay, creamy pasta.
Okay, with chicken. Please go ahead.
Okay,
We'd like to know what you think about it.
All right.
And if it's doctor approved.
Doctor approved. It looks doctor approved actually.
Okay.
Okay, so let's just take this. See how this. Okay, wait till.
Oh, that's suspicious for you.
This is like when they give you 2 injections because they are not sure if it will be enough for you. I beg you.
This, wow. Let me taste this.
So we'll take that as it's good. It's very, very good. He keeps going back for more. That's awesome. Well done, chef. Thank you so much.
Okay, so I'm going to say this on TV. Truthfully, I've never been a pasta person, but because of you,
converted.
I'll speak to my people at home. Let's start making pasta.
All right.
Thank you.
This is amazing.
Well done.
This 11/10.
Okay.
I've been missing out on pasta. That is life.
Actually, a lot of people have been saying it, that I've been missing out on pasta, but I'm like, pasta is not children's food.
Oh, wow.
But now I think I'm wrong.
Yeah,
so
wrong.
I take it back.
All right, amazing. I think it's very important to actually mention that he said he earns 10 times more than he earned. We'll have that conversation properly. It's very important.
You're exposing me.
But right about now, we do have a performer on standby, and he'll be rounding up the show and taking us away. Thank you so much for being here with us. We'll see you same time, same station tomorrow.